The reasons for that are that there are many diets or dietary patterns that are considered nutritious. These are some examples. For example, we have the DASH food pyramid, an example of the Mediterranean diet, the USDA MyPlate example, but you have many other choices too, the Nordic diet, the lacto-ovo-vegetarian diet, or of course on the right-hand side, what can be recommended to someone with any degree of hyperglycemia is consideration of a low or restricted carbohydrate diet, where you see carbohydrates are present, but they're comprised of fruits and vegetables with a lower glycemic index. Now, the reason I show all of those options is it actually doesn't seem to matter which diet per se a person is using for weight loss. It's actually adherence and not the dietary composition itself that predicts success in weight loss. And frankly, every person who's interested in losing weight is that they really find a diet that they will work with their lifestyle and that they can adhere to over time, because it really turns out that adherence and not the diet is what predicts success. This slide shows that in meta-analyses, including a meta-analysis of there were 4 meta-analyses performed in 2012, which actually included between 13 and 24 trials, and adherence was the feature most strongly associated with weight loss. So I think that's really a positive finding, and it allows us to engage in shared decision making so that our patients may choose from among a variety of options which may work best for them. And frankly, sometimes people have to try a couple of different approaches to dietary modification before they find one that really fits them best. This is another example of analyses that have shown that adherence is the most important factor in predicting the degree of weight loss that will be experienced in a person who is on a particular diet. This is an older analysis that included the results of people who were assigned to different diets, including Atkins, Zone, Weight Watchers, and the Ornish diet. And I think most important is on the right-hand side of the screen, you can see that irrespective, again, of the type of diet to which the person was assigned, it's really the adherence over time. The greater degrees of adherence were associated with greater degrees of weight loss over time. So again, a simple message, but simple to convey, but maybe not simple to achieve and maintain over time. We do know that adherence can be best early on, but adherence over the long term can be challenging. These are data, again, from individuals assigned to these 4 different diets, and these are their mean self-reported dietary adherence levels by month for these 4 diets that were popular at the time. And you can see adherence not bad to begin with on all of these diets, but this sort of steady and slow decline over time out to a year, where in fact there were very low levels of dietary adherence. So I think that reinforcement over time and recommitment will be very important to having someone lose weight and successfully keep it off.